A very good evening all. I am Aditi Lama with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 110 million cases of COVID-19 with nearly 2.5 million deaths. In the United States, we are nearing 28 million coronavirus cases with at least 488,000 deaths. Currently, cases worldwide are declining. However, experts fear the new variants could lead to another surge. Meanwhile, vaccines continue to be administered across the nation, with now the National Guard participating in administering more than 1.2 million vaccinations to civilians to support the expansion of the distribution efforts. The National Guard members are currently helping vaccination efforts in more than 33 states. In politics, today President Joe Biden consulted with top 10 labor leaders at the White House about his $1.9 trillion coronavirus relief plan and the need to modernize the U.S. infrastructure. They discussed how to put millions of Americans to work in good-paying union jobs, building roads, bridges, transit schools, childcare centers, and many more. President Biden is pushing hard to get bipartisan support right now. So how does all this impact us? We have done much on politics and coronavirus updates featuring doctors and political commentators. Here are the headlines. Dr. Bindu Balani on coronavirus updates and vaccines, Hackensack University Medical Center, New Jersey. Veteran journalist Rohit Vyas discusses U.S. politics and Biden administration, New Jersey. Dr. Rashna Kulkarni urges all to stay vigilant and follow CDC guidelines in New Jersey. It's time for a short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. I am Aditi Lama and this is Vision of Asia, Wednesday night episode of South Asian News. Let's take a look at coronavirus updates and measures. The U.S. Centers for Disease Control and Prevention is now projecting that there will be 559,000 COVID-19 deaths in the nation by March 13th. On coronavirus variants, the World Health Organization said that the UK variant of the virus has been identified in 94 countries so far. The South African variant has been found in 46 countries and the Brazilian variant in 21 countries. So again, as we all wait to be vaccinated, it's important to remember the 3 CDC guidelines more than ever. Practice social distancing, wash hands frequently, and most importantly, wear a mask. On vaccine, the nation is gradually ramping up the vaccinations with almost 2 million doses administered per day. President Joe Biden and his COVID-19 task force say that the United States will have enough vaccine for every American by the end of July. The president has also said that there will be over 600 million doses, enough to vaccinate every single American. So how does all this impact us? We spoke with infectious disease expert Dr. Bindu Balani. Here is Dr. Balani. Just discussing this fourth wave quickly, doctor, we here in tri-state in New York, New Jersey, Connecticut, even Pennsylvania, saw the worst of this pandemic last year. How concerned are you looking at these variants that we may become an epicenter again? What are the chances?
So unfortunately, northeast US, just like certain other ports, is a biggest port of call. With the global travel, with the how small the world is today, I think we are going to get more. And with the infectiousness and the closeness and the density of population in this northeast states, I think the spread, unfortunately, will also be much faster. And if we don't go ahead and do our social distancing and masking and hand washing, etc., I think we're going to be a little bit more troublesome.
Right, and you just mentioned mask, and I have to ask you, what is your take on double masking, which the CDC now has suggested as, adding another protective layer to against the virus? How are you looking at it? There are about 3 states that have actually lifted the mask mandate. Do you think that's wise right now?
I don't think it's wise at all. I think having a mask on is absolutely most essential than even 2 masks. I think having the double mask definitely increases the effectiveness of the masking. But I think just having a mask on appropriately, properly, on your nose, on your mouth, with a tight fit is, I think, probably the most crucial in requirement. So I think having universal masking is absolutely essential and should be maintained throughout all the states to try and help with as much drop in the inoculum as we can of the virus from one person to the other.
Right. Right. Let's now dig into talking about the vaccine, doctor, because I have a couple of questions regarding it. The first question is, we know there's not a huge difference between the Moderna vaccine and the Pfizer vaccine in terms of the mRNA technology that's been used, but are there differences in side effects or other differences you have seen in your research about these two vaccines?
So I think they're very comparable in their efficacy as well as effectiveness as well as side effect profiles. I think having a little bit of reactogenicity after the second shot in those who have never seen the COVID infection in the past. And why do I say that? Because if you've had COVID infection in the past, I think you can get the reactogenicity even with the first shot that you take with the vaccines. But that reactogenicity is, I think, very comparable to both of these mRNA technique vaccines that are currently around. Getting fevers, getting chills, getting body aches, getting soreness at the site of the injection, getting redness, a little bit of fatigue, etc. That occurs could happen in either or of these agents. The Bell's palsy that has been correlated, or with the media of the low platelets, etc. Those things are very far and few, and really have not had a direct correlation to the vaccine itself. I think they have to be looked at. I think they have to be monitored, given the fact that these are very new vaccines. I think we are all being very serious about any and or of these particular side effects, but I don't think it's really much of a difference with one or the other.
Right. And let's now look into Johnson & Johnson, doctor, because their vaccine dose is going to be a single dose, which could be a game changer. However, their efficacy is lower than Moderna and Pfizer. How are you looking at this vaccine? And is that efficacy enough right now for it to be distributed across the nation?
So I think it would be great if all of us could have the mRNA vaccine, right? It's 95% effective. But I think it's always supply and demand. And at this point, at this juncture, anything that we have today is going to be far better than nothing. So if there is a issue with the demand of and supply of the mRNA vaccines, I think having a 50 to 70% efficacy of any other vaccine that we have is going to be the crucial key. Plus the fact that it has a very significant advantage of being a single shot, I think that's phenomenal. I think having a vaccine that is going to give you that 50%, 80%, 60% efficacy very quickly within 2 to 4 weeks after taking a single shot is going to be far better than having zero efficacy at all, and or even down the road at the with the mRNA techniques, which still take at least 6 weeks, given the fact if you take Moderna, for example, it is 4 weeks of vaccine time and 2 weeks thereafter. So I think the added protection that you get with an earlier efficacy point, I think, is far better than having zero. And also, actually, let me put in one more word, that even though the efficacy overall is slightly bit lower, the efficacy in severe disease and hospitalized patients is great. It's 85+%, which actually decreases the chances of you getting into a hospital. So yes, you may get COVID and you may be in that small mild to disease category, but having being saved from severe disease is, I think, a big positive impact.
That is so true. We're just trying to hope the vaccine gets to everybody here, because it's the biggest weapon against this virus. What about AstraZeneca, doctor? The WHO, World Health Organization, just approved it to send it to poorer countries, in their effort to vaccinate all across the world. How are you looking at the research in AstraZeneca? Do you see it being approved here in the US?
So I think it is a phenomenal medicine again. Why? Because the maximum advantage that we have there is the ability to have that particular vaccine at room temperature. Right. So in certain areas, even in US, if you look at certain Midwest where they have to travel a long distance to get there, and where the number of people may not be as much, that to have a Pfizer unit or having a storage of -70 may not be feasible. So I think having the ability to deliver vaccines to areas where there is financial, economic burden, where there is less resources, etc. I think having an agent that's going to get you to that 50 to 60% efficacy is going to be very, very good. So I think having AstraZeneca on the armamentarium of approved EUA vaccines has been a great advantage to the world.
More on coronavirus updates and measures. The Biden administration plans to provide $650 million to expand COVID-19 testing for elementary and middle schools, as well as homeless shelters and other underserved congregate settings. It will also spend $815 million to increase U.S. manufacturing of testing supplies and $200 million for virus genome sequencing. This comes as the CDC suggests that it is not mandatory for teachers to be vaccinated in order to return in person, a key priority for the Biden administration in its first 100 days. Dr. Anthony Fauci on that said that getting all teachers vaccinated before schools can open is practically impractical right now, but said that we should try as best as we possibly can to vaccinate teachers, and they should be as high priority within the essential area personnel. On this and the ongoing downward trajectory of COVID-19 cases and deaths, we spoke to expert Dr. Rashna Kulkarni. Urging all to stay vigilant, here is Dr. Kulkarni. There are some numbers coming in today that I'd like to discuss. We're looking at 27.8 million cases of coronavirus in this country, with at least 488,000 deaths. We are approaching a milestone, a very grim milestone of 500,000 deaths in the nation. We are hearing that currently the cases and deaths are going down. The trend is going down. I'd like to know if that's actually happening, because the numbers that are coming in are massive.
There is a silver lining to this cloud, Aditi, the dark cloud that has engulfed us in this entire last year. The cases, although the actual number is very large, the cases have started coming down. In addition, even if we have infections, not so many patients are succumbing to the illness, dying, because now we do have treatment options available. So that's encouraging. So total number of cases are coming down, the deaths and hospitalizations are coming down, and we finally know that the medications that we have, the treatment options that we have, are working.
Right. So there is some positive news coming in here. I'd like to now know, experts are currently worried about a fourth surge due to the variants. How are you looking at it? How concerned are you about that? Are we going to see fluctuation in cases and deaths coming up?
It certainly looks that way, because it's a virus, right? So virus is going to mutate. It's no different than mutation of a flu virus. So influenza virus mutates, and every year, wherever the flu season starts, the scientists try to study that and quickly adapt the vaccine to cover as much or as many mutations and as many strains of the flu virus in the flu shot as possible. I don't see any difference here, because the virus is going to mutate. New mutations are going to come out, and the scientists, and my salute to them, they will have to adapt to the new strains and change their vaccine composition accordingly.
Right. When you're looking at these variants, Dr. Kulkarni, can you give us some insight into the UK variant and the South African variant? South Africa as a country had to stop AstraZeneca vaccination due to the variant that's there, and the UK variant is spreading all across the United States. How are you looking at these two?
Those two variants certainly are concerning. And let's talk about the South Africa variant first. As you know, you just alluded to, that the AstraZeneca vaccine, which was about to be rolled out by South Africa, they had to pull it back because that vaccine showed to have very little efficacy against this new strain. And now the J&J vaccine is being given. So, we know the shortcomings of AstraZeneca vaccine against that variant, so it won't be much effective. The UK variant, at this point, it seems like the majority, the big players here, the Pfizer and Moderna vaccine, looks like it is going to be effective against that virus. Having said that, the UK variant is a lot more contagious. So I would suggest to all your viewers and listeners that because of the contagiousness of this virus, let's make sure we continue to take the precautions of masking and social distancing if we could.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I am Aditi Lama, and this is Vision of Asia South Asian News segment. In politics, yesterday President Joe Biden took center stage in Milwaukee to make the case for his $1.9 trillion coronavirus relief package and called on Americans to stay vigilant against the pandemic. This was the president's first major political trip outside Washington, D.C., where he vowed that he was committed to passing the relief legislation, claiming it would create 7 million jobs this year and that the economy now has to be dealt with. He said now is the time we should be spending and that now is the time to go big. He also hopes that by next Christmas we'll be in a very different circumstance. Bringing more insight into COVID relief package as well as executive orders signed by the president, we spoke with ITV Go's senior political commentator, Mr. Rohit Vyas. Here's what Mr. Vyas shared with us on US politics and the Biden administration. Let's talk about this Biden administration a little bit because there's a lot that's happening again and we want to get to the core of it. This week, President Biden is traveling to Wisconsin and Michigan on his agenda, which is the pandemic, defeating the pandemic, and reviving the battered economy. What do you think are his major challenges ahead in those two departments?
Major challenges, number one is getting control of the virus. And hand in hand with that is to roll out the vaccines quickly because the population needs to be vaccinated as quickly as possible to be able to somewhat end this pandemic. We don't even know how it's going to work. If it does not roll out swiftly enough, if the vaccines do not roll out swiftly enough, we may lose control of the pandemic and have to go through these cycles a couple more years all over again. I think that's why he's giving this urgent thought to it. That is why there is this urgent feeling for it. And that's why he wants to hold these town halls. He wants to go out and address the public, take his message out to the people directly to tell them what needs to be done and explain it to them in a way that they are convinced. The other thing is, of course, the economy, which you mentioned. Yes, they go hand in hand. The pandemic is the reason for the vast destruction in the world economy. And now the repair must begin. And that repair process begins along with the vaccination rollout, controlling the virus spread, which means masking up, wearing gloves where necessary, social distancing, and all the things we've come to get used to now in this past year. And I think he's trying to take that message out to the people. It has not been done in the past several months, of course, under the Trump administration, as it should have. Initially, the Trump administration did go to the people, did talk about locking down and all the rest of it, and then distracted itself from those maneuvers. And so we now have to get back on track. And I think that's what he's trying to do.
Right. How are you looking at the $1.9 trillion COVID relief package and especially the $1,400 stimulus checks? Why are they trying to do this massive COVID relief according to you, and what will be the impact of that?
Well, the idea is to go big right now when the interest rates are low, and even if the deficit were to increase, because obviously the United States Treasury itself would have to start borrowing money to pay all this out. And it would accrue interest, and that's what leads into generations of, being in the red. And I think that's the biggest fear. The conservatives, especially the Republicans, have always been wary of that, about going into the red too deep for future generations to have to pick up that burden, that financial burden. But Biden has spoken very, very equivocally, very clearly, as his now Treasury Secretary Janet Yellen has, that if we've got to go big, let's go all out now. Interest rates are almost at zero, and in fact are at zero in many, many respects. And therefore, borrowing is not expensive now. So if you have to borrow, we borrow, go out there, flood the economy, get people, support people that need to be supported because there are still millions who are unemployed. There are many who are not going to get those jobs back ever again. There are many businesses that have been destroyed by the pandemic and its consequences. And there are many state governments that are in dire financial states, which also need assistance, Republican or Democratic states. So you got to go completely big. The 1.9, I think, is a little less, actually. It should have been 2 point something trillion, I thought. I'm no economic expert, but just logistically and logically thinking, I think you need to go bigger. But he's going big enough. And I think once that's through, we'll see by the end of this year, things should be much better. There will be an economic turnaround and a health turnaround as well.
So let me ask you a quick pointer, and I believe I've asked you that before too on the show. Do we have enough money in the country right now to help every single American?
Oh, yes, absolutely. This is the richest country on earth. There are trillions of dollars that the corporate world also has stacked up. Bill Clinton used to point this out all the time, as did President Barack Obama, as did President George W. Bush, that people also forget that corporate America will play a big role in all of this too. And there's a lot of money that corporations have sitting doing nothing as well. So there are places to borrow. There are places to allocate funds through tax breaks or whatever, and to be able to take care of those at the bottom rung of the ladder in the United States. Now, you can't have a socialist system, obviously, where you're going to just support people endlessly. No. The idea is not to support people endlessly, but this has been an unusual year in our memory, in recent memory, and probably in memory for the last couple of centuries. We have never faced a crisis like this. It is not of anyone's doing. It is a natural occurrence, or in some cases, maybe someone will say an unnatural occurrence, that we had a virus of this type that came out and affected all of us. But we know essentially it brought the world to its knees. And so the only way you can fight something like this is go on that war footing. As Biden says, he says we're at war with this virus. He's right. We are at war with this virus. Donald Trump said the same thing early on. It's like going to war. We're going to war. And he says, look at all these, frontline workers putting on their gear. They look like soldiers fighting. And he was right too. It is a war against this virus, and once we get it under control, we'll be fine. We don't have to be a socialist state to do that, but we do have to inject enough into the economy to get us out of this morass.
I just have 3 more questions left here for you. The first one is President Joe Biden has signed a series of executive orders since he's been, the president of this country. Which executive orders stood out the most for you? Which were the most important ones?
I think the ones to halt the separations at the border,
right.
The protections for the DACA recipients, they've been in limbo, they've been worried, etc. The Affordable Health Care Act, the Affordable Care Act, Obamacare, to extend some of those provisions right now, especially during this health emergency. Very important executive actions. Reversal of the so-called Muslim ban.
Right.
I'm not sure that was a top priority at this time, but he believed it was wrong, and therefore he signed that executive order. That was one of the first ones he signed on day one of being in office. But just about every one of the executive orders has been focused on undoing what President Donald Trump had sought to do. And that was to bring back some order now into the process. Immigration has always been a very complex issue. It will continue to be a complex issue. Trying to solve it with an executive order, either under the Trump administration or under this one, is not going to be the way out. Eventually, it's going to be legislation to find especially a path to citizenship for the 11 or 12 million undocumented workers in this country. And once that happens, I think we can begin to strengthen the borders a lot better and make sure that there isn't a porous border where people can just come in and out.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.